How a European Commission audits in the area of health and food safety planned, prepared and performed. All audit and non-audit related activities in the area of health and food safety of the European Commission follow a clear and transparent process and are based on a broad, multi-annual and detailed annual work programme. This is developed in consultation with EU member states and takes into consideration factors like risks to consumers, animals and plants, trade matters, regulatory obligations or policy priorities like antimicrobial resistance and more. Clear priorities and objectives are defined. What health and food safety systems shall be audited and in which EU member states or non-EU countries. Before travelling to a country for an audit, the European Commission auditors first assess available information on paper to see, is a system of official controls in place? And can the system work in theory? Information looked at includes the organisation and management of the food safety system, the legislation in force, notifications of food or plant safety alerts, how non-compliances are rectified, specific issues such as laboratory standards, previous audit reports and trade data, to name a few. The auditors then send an audit plan to the country. This plan outlines the key objectives, the relevant legal references and the dates for the audit. It also aims to clarify open questions and to start the development of an itinerary, which is subsequently finalised. All places and visits included in the itinerary are chosen by the auditors in cooperation with the competent authorities to get an objective assessment of the food safety system in place. Then the auditors travel to the country to check, does the system work in practice? Each audit starts with an opening meeting between the auditors and the country's competent authorities. At this meeting, the objective of the audit process, and the itinerary are again confirmed. The competent authorities present key elements of their control system, which are discussed. The discussions include, for example, how are the competent authorities organised and cooperating to ensure that they work effectively together? How do they take decisions and verify that their control system works? How have recent non-compliances been dealt with to identify and eliminate their cause and reoccurrence? And many more topics are discussed. After the opening meeting, the auditors travel to several administrative regions of the country to meet the competent authorities at regional and local level and to go with them, for example, to farms, food or other establishments and laboratories. The aim of these on-the-spot visits is to verify if the control system works in practice, or if improvements are required to comply with EU standards or international standards accepted by the EU. Importantly, those visits serve as an example for the EU auditors to see and assess how the competent authorities implement their control system at every level and point that's important for safety. At the end of the audit, a closing meeting takes place, during which the European Commission auditors share the preliminary outcome of the audit. Their aim is to give an objective and balanced assessment whether the food safety systems work in practice and where shortcomings were found which need to be corrected. The competent authorities of the country are then invited to make comments on the assessment, if any. Then the auditors return to their base in Europe, where they start the process to document the results in the audit report.